In today's world, social distancing has become the norm. But sometimes, being clingy can also help us to prevent spread of COVID-19 in an eye hospital. When the patient's head is on chin rest, the nose of the patient is in close proximity to the front surface and the lens of the machines like OCT and lasers. Hence, aerosols can settle as fomite on the lens surface and possibly can get transmitted to other patients on subsequent examinations. Here we show an innovative use of cling wrap to prevent spread of COVID-19. Take adequate length of the Klingon wrap to cover the front surface including the lens and the sensors of the machine, attaching it to the side walls. The entire process of covering hardly takes 5 minutes to complete. Make sure that there are no folds in front of the lens. The covering can be easily cleaned between patients and changed at the end of the day. As you can see, the scan quality is not affected. This picture shows a comparison of image quality obtained in an undilated patient without and with the front cover. For cleaning, isopropyl alcohol can be used. Take a clean tissue paper and spray isopropyl alcohol on it and clean all around, especially the area covering the lens and the sensors. We can see that the cover is absolutely clear with no contamination or fogging. In a similar way, you can use the cling wrap to cover your Pascal laser delivery systems. Just make sure there are no bubbles or folds in the front surface. On comparing the laser marks with and without the cling wrap, we found that the ones obtained after putting the cling wrap were slightly smaller in size, but we did not find any significant difference in the clinical scenario. For cleaning, isopropyl alcohol can be used. Just spray isopropyl alcohol in a clean tissue paper and clean gently all over. Use gloves while doing so. A similar method can also be used to cover your YAG capsulotomy laser machine. Here too we observed that the spot size was slightly smaller in size, but again it was not clinically significant. This is a short video demonstrating technique of modifying ophthalmic lenses to prevent contamination and the safe practices to be followed during IDO and slit lamp biomicroscopy examination. As we can see, while examining, the lenses come in very close proximity to the nose of the patient, hence fomites can settle on the surface and increase the risk of transmission on subsequent examination. Repeated cleaning of the lens is cumbersome and can damage the lens, hence following modification is useful. Take a PVC pipe of 2-inch diameter and cut it as shown in the figure with a thickness of approximately 1 inch. Take a transparent plastic sheet of adequate length, put a strong adhesive on the edges of the cut PVC pipe and keep it over the plastic sheet. Cut the sheet surrounding the pipe. Now take a double-sided adhesive tape and cut it into 4 small pieces. Stick the 4 pieces on the inner side of the pipe, one over the other as shown in the image. Clean the 20D lens with isopropyl alcohol and a dry tissue paper. Then insert the lens into the cut pipe, keeping in mind that the surface which has to be towards the patient is near the front plastic cover on the pipe. The modified 20D lens is ready to use. A 90D can also be modified in a similar way using a 1-inch CPVC pipe, the only point of difference being instead of putting 2 double-sided tapes one over the other, only a single layer of tape would suffice. Another modification is using a cling wrap to cover the 78 diopter lens, which will be described later in the video. Now coming to the safe practices during an IDO examination. Modified lens for the examination. The front surface of the lens is covered with a plastic sheet, preventing the direct contamination of the lens surface. This gives a good view of the fundus with minimal reduction in quality. Cleaned using the same spray and a clean tissue paper. After removing the end. Now coming to slit lamp biomicroscopy. As you can see, we have put a cling wrap on the lens surface facing the patient so that the front surface has a covering and the back surface is bare. The lens is kept in a box with layer of dry tissue paper underneath. If required, an elastic band can also be used to further secure the covering. On proceeding with the fundus examination, the fundus details are made out quite clearly. This is a picture showing the comparison between the image quality of a 78 diopter lens without and with the front cover. After the examination is over, disinfect the front covered surface with isopropyl alcohol spray. The lens surface is not wiped to avoid any marks. The lens is kept back in the box layered with tissues. As the tissue gets soiled, the topmost tissue can be removed and the process repeated subsequently. In this COVID era, one of the common sources of infection transmission is through touching the door handles. Yes, cleaning the door handles would be the best, but how often in a day can we do that? Here we describe a simple jugaad to solve the problem. A thin metallic string is bent and hung on the face of the door with cut piece of newspaper clipped onto it. Every time one needs to open the door, take a piece of the newspaper from the string and pull the handle using it. The door can be kept in place with the right leg, and with the left leg the dustbin can be opened and piece of paper discarded as you walk out. Thank you.